Hello, I'm Cindy Ehrenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. In recent years, those working to prevent infant mortality have focused on two key areas to reduce deaths among infants and toddlers: water safety and unsafe sleep practices. As a result, a number of public awareness campaigns have been launched, including the Safer by 4 campaign that educates the general public about keeping children safe and healthy through their 4th birthday, a time after which the risk of accidental death drops considerably. In Broward County, safe sleep education is an integral part of the work of the maternal and child health systems of the Children's Strategic Plan. Today, we're going to focus specifically on safe sleep education as an immediately impactful way to help prevent approximately 17 deaths a year in our community. Here with me to talk about ongoing efforts in Broward to protect babies through safe sleep practices are Monica Figueroa King, the Executive Director of the Broward Healthy Start Coalition, Rachel Alexander, Safe Sleep Program Manager with the Healthy Mothers, Healthy Babies Coalition of Broward County, and Madeline Jones, our own Assistant Director of Program Services with the Children's Services Council of Broward County. Before we start, however, I would like to look at 2 recently produced public service announcements that try to grab the attention of parents and caregivers to get their attention on this issue from slightly different angles.
When putting a baby to sleep, it is important to follow the ABCs of safe sleep. Babies should be alone, on their backs, and in an empty crib. When we skip any of these steps, like letting them sleep in bed with us or with their favorite stuffed animal or a pillow, we put our babies at risk. And on an average, 1 baby dies every 3 weeks in Broward County due to these unsafe sleep practices. Protect your baby by following the ABCs of safe sleep. Learn more at hmhbbroward.org.
Neighbors for Neighbors wants you to know that when putting a baby to sleep, it is important to follow the ABCs of safe sleep. Babies should be alone, on their backs, and in an empty crib. When we skip any of these steps, like letting them sleep in bed with us or with their favorite stuffed animal, we put our babies at risk. And on average, nearly 1 baby dies every other week in our community due to these unsafe sleep practices. Protect your baby by following the ABCs of safe sleep. Learn more at neighborsforneighbors.org.
So, pretty impactful. Certainly the message is clear: alone on your back, alone on their back in a crib, and but they take slightly different approaches. That first one rips my heart out. Right. But Monica, why would we want to do that? What is it that's so important that we're trying to grab these parents' attention and tell them alone on their back in a crib?
Well, first, Cindy, thank you for having us here. This is such an issue that we can get our hands around and really wrap our fingers around. The Broward Healthy Start Coalition is a leading advocate in the maternal child health system, and we have had just an incredible partnership with the Children's Services Council and so many community-based providers around how to help new moms and pregnant moms. But this is an issue that is clear and specific that we can really solve, and be able to educate not just moms, but any kind of person that is involved in taking care of a child. So fathers, child care workers, hospital staff, medical staff, and really getting them to understand how in the last 10 years we've had over 150 deaths that were completely preventable on how we put our children to sleep and our young infants to sleep. So from the Broward Healthy Start Coalition perspective, we're grateful to have such a strong partnership with this community, and really have been able to amp up the message and really get to every corner of this county and really just speak to the public around this important issue.
And Monica, we as well are so grateful for the partnership and love having you over there at the Healthy Start Coalition, doing a great job. And you know, all of us were babies once. We have a lot of viewers who have raised children in the past, and some of them have a hard time wrapping their head around this new alone on their back in a crib. Why? That's not the way I did it. I used to sleep with my baby nestled against me. I did, my grandmother did, whatever. Rachel, what do you tell them? Because this is really your job. You're out there every day trying to get that word across to new moms and dads?
Right, absolutely. Well, my answer to that is pretty simple. I mean, prior to 1992, the American Academy of Pediatrics recommended to the nation that we put our babies to sleep on their stomachs. And then in 1992, they changed the recommendations because they realized that these deaths that they thought were SIDS deaths were actually sleep-related deaths, which are 100% preventable. And so when they did the studies and research, they realized that the recommendations needed to be changed. And so the grandparents, who are now, seeing their children come home with children are saying, oh no, when you were a child, I saw, I put you to sleep on your stomach. You have to flip that baby over. And in matriarchal societies, the parents listen. So since we have changed the recommendations since 1992, it's important that we now heed those recommendations from the American Academy of Pediatrics as the rates have dropped, the death rates have dropped. And so we know the ABCs of safe sleep alone on the back and in a crib is very effective.
And, all of those baby bumpers and everything are so cute, and they're in all of the stores, but once that baby can move around, finding a baby suffocated because of getting stuck there is a heartbreak you don't want any parent to go through.
Right.
So you talk about that as well, right?
Yeah, absolutely. To kind of say, once a baby can move around, babies can always move around. They can move around on their backs, they can move around on their stomachs. What happens with bumper pads, which they're a multi-billion-dollar industry, which is why they are being sold, is babies like to nuzzle, they like to snuggle, they like to be close to objects. And so what happens is something called a pocket of CO2. These infants are getting close to these bumper pads and nuzzling in, and they're breathing, and they're creating their own pocket of CO2, and they're actually breathing in their own carbon dioxide. And since they don't have something called an arousal threshold, which is an ability to wake up if there's a problem, these babies are not waking up, and they're passing away in their sleep. And so bumper pads are very dangerous. There's no need for them. The only reason really why bumper pads were created initially, as I stated prior, in 1992, the AAP changed the recommendations. Well, one of their recommendations was that crib slats needed to be no larger than 2 3/8 of an inch apart. Prior to that, they could be as large as they wanted.
Baby's head.
Exactly, and so babies were falling, they were strangling themselves, they were, getting into accidents, and so bumper pads were created. They're no longer necessary. In fact, they're actually a danger to these infants' lives. So.
And making sure there's a safe crib is also really important. And Maddie, the Children's Services Council has gotten involved in this, as we do in many things, in the Cribs for Kids program, as well as the Safe Sleep. So can you talk a little bit about that?
Yes, absolutely. Thank you, Cindy. It's just, I'm still thinking about those numbers from those public service announcements. It's just absolutely staggering and unacceptable. But, as we're saying, there's just so many different reasons and so much education that needs to happen. The Children's Services Council of Broward County has been supporting the Cribs for Kids initiative since 2007, and that program is run through Healthy Mothers, Healthy Babies. And Rachel is one of the trainers that goes out and educates the community and police officers and really helps us to get the word out about the dangers of co-sleeping and really just trying to promote safe sleep. Last year, Healthy Mothers, Healthy Babies actually gave out 650 cribs, which is awesome. They're doing a great job, and we're just really proud to support this initiative because it really is all about prevention. And there's other programs that we fund as well at the Children's Services Council, like Healthy Families Broward, who does parenting education, and they work with young mommies of all ages and babies and really providing this education in the home. And there's cultural reasons, there's income that they're not able to afford cribs sometimes to give babies their safe, appropriate space. And also part of the confusion and the mixed messaging, I believe, is the fact that we also want to promote breastfeeding and the health of breastfeeding. Well, sometimes, being a mommy myself, I know that it is sometimes easy to bring your baby and snuggle in the bed and nurse them, and then you know, sometimes you just maybe don't want to put them right back, but the message is give them their safe space. Put them in the room with you, you know, in a bassinet. There's other portable crib options where you can, you know, still nurse your baby, but then put them in their safe space without having, you know, the stuffed animals or any other dangers that could be in the crib with them.
And we're not suggesting that you can't snuggle with your baby.
Right,
You
no,
have to.
definitely
You must.
not.
That bonding is so
Right.
important.
Critical, yes.
But you can't be sleepy. Like,
Right.
the danger is you falling asleep with the baby snuggled
Exactly.
to you.
Right.
That's when you can accidentally suffocate them.
Yeah.
And I can't imagine anything worse than
No.
waking up and finding that your child is no longer breathing.
Right.
So it's really being conscious. Also, you know, the dads on the couch saying, oh yeah, I'm just gonna snuggle here, this is really nice. And then
Right.
not realizing what's happening, because we tend to sleep pretty heavy.
Right.
Monica, I want to bring you back in here because for those who doubt that this is true and they think, oh no, it's really just an accident. I mean, it's not intentional. Certainly no one is claiming that this is intentional.
Right.
But you're actually involved at Healthy Start Coalition with the Community Action Team or the Community Action Group that looks at the fetal infant mortality review project that gets at the root causes of what actually caused these deaths to happen. And you're seeing this, right?
Absolutely. I'm so glad you raised that issue. I mean, truly, it all goes back to looking at the data and looking at the information that we have. So, and that's key in any behavior, in any ideological change that we're trying to do in society. I mean, you know, just like the change in smoking in our society, the change in lots of behaviors in our society over time have come over knowledge that comes, data that comes, the research that comes, and the fetal infant mortality review project that's been taking place in this community. And the Broward Healthy Start Coalition is very involved with Healthy Mothers, Healthy Babies, and really looking at that information. And just like the American Academy of Pediatrics made that recommendation, it was clearly aligned with what we were seeing in the data that was coming from it's called the FEMUR process. And so, you know, we've been very grateful to have funding from the Children's Services Council along with the Department of Health from the state, and really looking at those fetal and infant deaths to understand what are the causes, what are the concerns, and you know, and every day sort of evolving and learning. We're putting cribs in, but there's more to do. Sometimes we're finding cases where there was a safe space option there, and a family didn't take advantage of it. Because they just had not made that shift in their mind and really understood how important it really was. And it's going to take a lot of reaching to our community, through the faith-based community, through every place that we can think of, to really have them understand the importance of the issue. And so being able to talk about it on this show, being able to talk about it at community fairs, through your church, through your child care, your beauty salon, your hairdresser, to figure out that, and letting them know that it's not okay. You may have thought it was okay, it hasn't happened to you, and it's not that we're having thousands of children die, but one child is too many, and we already have way too many children dying every day here, over a period of weeks in this county for something that's completely preventable.
I'm proud that we've brought the number down, but I don't think any of us will be satisfied until the number is zero.
Exactly right.
And talk about non-traditional partners. Did you want to say something before?
No.
Okay. Non-traditional partners, Healthy Mothers, Healthy Babies has worked with fire rescue and the police and created the DOSE program.
Yes.
Rachel, talk a little bit about that, because I love this.
Yeah, we're very, very proud of the DOSE program. DOSE stands for Direct On-Scene Education. And we partner with the first responders in the community, initially in Broward County, but now we're national. I'm shipping out DOSE materials to other states, which is
Leaders again. That's Broward County.
we're very proud of it. Every time I go to the FedEx office, I'm like, yay, we have another shipment. But basically what we do is we train first responders when they respond to a call to check for the baby or the infant's sleep environment. And as the first responders are trained, they see these unsafe sleep environments, and then they have that opportunity, that teachable moment really, to say to the parents appropriately, this is really not a safe sleep environment, let's get you a crib. And oftentimes they have a crib, a Graco pack and play in their truck, in their car, in their police car, and they get the paperwork, and they train the families right then and there, direct on-scene education. And we follow up at Healthy Mothers, Healthy Babies by going out to the home and making sure that everything is okay, and that the parents really are following the ABCs of safe sleep and so on. So that really is something that we're very, very proud of.
And those first responders are not there because of the baby or because of something that happened. They just happen to be in the home for another reason.
Right.
And don't worry, viewers, they are still paying attention to the reason that they showed up at the house, but usually there's a lot of them that show up at the house, and so we're taking advantage of those extra hands on deck.
Right,
Which
is fantastic, because that's just another avenue to get in to the general populace. These first responders are responding to other calls. In those moments, they see the need for a safe sleep environment, and it's provided. And so it's not as if a parent is saying, I don't have a crib for my baby, and that's why I'm calling 911. That's not at all what's happening.
Right, they're going there, somebody's having a health crisis. In my case, I saw many times, sadly, when my dad was ill, the paramedics would come. 2 people would be dealing with Dad, 4 guys would be standing around because they weren't sure how many of them it would take to move him out, to do whatever. And so those 4 guys standing around may spot, oh, it looks like there's a baby here. Is there a safe place for that baby to sleep?
Exactly.
And then they're acting on that while the people who need to be taking care of the patient are taking care of the patient.
Yeah.
So everybody's taken care of, but our first responders are really fulfilling a broad mission of health in our community.
Yeah, it's a fantastic opportunity.
It's great.
Yeah.
And we do want to engage people. There are ways, though, you brought up the point that it's not mom or dad calling 911, and we don't want them to do that to get a crib, but there are ways to call and get connected and get a crib if they need one, or a pack and play.
Absolutely, yeah, they can contact our agency. We do have a Cribs for Kids program that I oversee, and every Wednesday at 10 a.m. we do information sessions for parents who need pack and plays, who fit the criteria. In addition to which, I go out into the community. I go out into preschools. I'm actually going to one tonight. I go out into organizations like the Urban League. I go out and do presentations. A couple weeks ago, I did a presentation to 120 grandparents, which was really, really fun. And so, in those moments, I have people coming up to me saying, oh, I could really use your services, or even things like, I can't believe I did everything wrong when I was a parent. I put my baby to sleep on their stomach. I had no idea, and my response to that is, well, you got very lucky. So we encourage people to call our agency to receive these services. In addition, not just to the crib, we also give education services. When they get the pack and play, they get the fitted crib sheet and the training, the safe sleep training.
Yeah. I think the other key thing I wanted to make sure we got in there is, and you touched on it a little bit, Rachel, is that making sure that you're also picking a safe care, your caregiver, your babysitter. So, Rachel and Healthy Mothers, Healthy Babies has been doing a really fantastic job of educating the community, and it's everyone, because at some point you may be caring for your neighbor's infant, or the grandparent who isn't maybe aware of the most recent information. So we really are trying to get to every avenue where there could be someone who is taking. So that importance of a safe caregiver, not just that they're safe and that they're going to be responsible and know CPR and all the things that you want them to do, but that you really talk to them. Where are you going to put my baby to sleep? I go run an errand, when I have to go do something, and that they're as informed as you are. It's really what we all are trying to do and get the message out.
Informed about how to soothe a child as well. I mean, when we hear about some of the bad abuse happens when a baby is crying and you can't seem to find a way to console them, there are several methods to do that, and making sure that the caregiver is informed about that, so that they're not responding in anger.
Also, we have many family strengthening and home parenting programs, as I mentioned a couple of them before, but as part of their assessment, just gathering information on how they can help the families, they do home safety checklists. And that's really important because, you know, before safe responders even get out to the home for another reason, you have home visitors there that are working with the family on other things, but they're also looking to see where is the baby sleeping and looking to see what type of resources might be available to link them, whether it's a crib or just that education to really help the family and help the babies grow healthy.
I'm so glad you said that, because that's actually another big part of my position, is going out, like I said, into nonprofits and training social workers, training counselors. While you're out in the homes, you know, these workers are doing fantastic work, very difficult work and arduous, and they have, we have a resource, we have a free curriculum now that we provide to counselors. It's actually a flip book. We have it in English, Spanish, and Creole. It's called Sweet Dreams, Begin with Safe Sleep. And they can go out into the community and just flip the pages and read the bullets, and you know, it starts with my training. So again, I encourage any nonprofit organizations that would like to reach out, please reach out to our agency. I would be happy to come and give the safe sleep training.
One of the things we didn't talk too much about is also the baby itself.
Yes.
Because now we've said alone in the crib.
Yes.
I know. And not blankets and no pillows. So for me as a mom, that broke my heart. I'm like, oh, my poor baby, what's just going to be lying there? So I know Leia was always in footy, long sleeve pajamas, or before that, swaddled up nice so that she would feel cozy, and then those long sleeve footy pajamas. So there are ways to make sure that the baby is snuggled and cozy. Anything I'm forgetting?
Yes.
New moms.
Those
and
onesies are the
training.
best, I tell you. They're easy.
We actually provide Halo sleep sacks as well. Halo sleep sacks are wearable blankets for infants, and so there's no need to put a blanket on the child, because a baby gets a blanket in their hand, and as soon as baby gets something in his hand, he puts it right in his mouth. And that's a choking hazard, and so Halo sleep sacks are wearable blankets. Also, in addition, a lot of the issue that we're seeing in some cultures is overbundling, overheating. Parents are so concerned that their child is going to overheat while sleeping that they put layers upon layers of clothing on their baby, which is a hazard. The ideal temperature for a baby to sleep is anywhere from 69 to 72 degrees. So we encourage parents to have an overhead fan, a standing fan, which is facing away from the baby, not an oscillating fan, and if so, then away from the baby. But really, babies only need one extra layer of clothing than what we have on. So I have one layer of clothing. If I were going to put a baby to sleep, tops I would put 2 layers of clothing on that child.
So we're running out of time, but I'm going to share one little tip, because I had a trauma as a new mom when one night my baby would not stop crying. She was just screaming, and I couldn't figure out. I had changed her, I had fed her, I didn't know what happened. And it turned out her little finger was stuck in the sleeve of the onesie.
Oh.
So from that point on, we both learned how to count together and made sure all her fingers and toes were in good shape. We counted her fingers and toes every night, and let me tell you, she learned how to count very young. She was very good at getting to 10.
That's a great tip.
That is a great tip.
So check those fingers, check those toes. They all need to be ready to wiggle. So it's very simple implementing safe sleep practices, and they will save babies' lives. We want to make sure that the information is shared widely. If you know a baby, if you have a baby, please share this information. Make sure that they know they're supposed to sleep alone on their back in a crib. I want to thank Monica Figueroa King, Rachel Alexander, and Madeline Jones for joining us today to talk about the importance of outreach and education on this subject. For copies of this program or any other episode of Future First, including the public service announcements that you saw today, please access our YouTube library through our website, cscbroward.org. Like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children.